There are different types of breast cancer, and these are defined by biomarkers. So the three biomarkers are ER, which is the estrogen receptor, PR, progesterone receptor, and HER2, which is a protein.
Some of these tumors don't have any of the three receptors, and we refer to those tumors as triple-negative breast cancers. Today, we classify triple-negative breast cancers as one of the most aggressive types of breast cancers.
For someone who's newly diagnosed with triple-negative breast cancer, most of the time they will need chemotherapy. So any triple-negative cancer that's over 1/2 centimeter or has lymph node involvement needs chemotherapy. And this is usually 2 different types of chemotherapy for 3 months each with 2 different classes of drugs. One is called taxanes and one is called anthracyclines.
We know that these tumors, that the systemic therapy that we have to give for these tumors can only be chemotherapy, because we cannot give any of the targeted therapies because, again, this tumor doesn't express any of those receptors.
After chemotherapy, depending on the type of surgery they have and the stage of the cancer, they may need radiation. And after they're done with the active part of treatment, they'll be followed by their doctors every 3 to 6 months with physical exams and routine mammograms.
One of the things that we have shown a long time ago is that whether you give the chemotherapy first, before surgery or after surgery, there's no detriment to giving it beforehand. And in fact, we think now we learn a lot about how the tumor behaves by giving the chemotherapy first. So we can see how much the tumor shrinks a considerable amount of the time, about 40% of the time, and the tumor will disappear completely.
And I would recommend meeting with a genetic counselor to go through your family history if there's a lot of cancer or many people that have had breast cancer, because they can actually look at the whole picture and tell you if you need genetic testing.